Welcome to the AACS Daily News. Attleboro firefighters and emergency responders have recently started to receive COVID vaccinations. Attleboro Fire Chief Scott LaChance spoke about the process.
We're here today. This is our first day of the Fire Department First Responder Vaccine Clinic. So we're starting the vaccines at about 2 o'clock today from 2 to 4. We're running the clinic over a period of 3 days. We're close to around 70 to 75 of the members of the department have signed up for the vaccine, so that's about 75%. We're expected a few more will sign up in the next day or so. So we're pretty happy to have this going on, and hopefully this makes a difference in the long term for all of us. The good thing, I guess, is if you either tested positive or assuming if you have the full vaccines, that you're not considered an exposure for 90 days at least. So one of the challenges for us in the department is there's a lot of exposure. You know, we've had close to 30 members of the department have tested positive since March. So every time you get 1 or 2 tests positive and we do our own contact tracing, you know, you always end up with a few more. So we end up quarantining a lot of people, which makes it hard operationally. Plus these guys, you know, girls, women go home and, you know, they may have to quarantine or have their families quarantine. So the vaccine hopefully is going to kind of, you know, almost eliminate that for us, at least, you know, for the foreseeable future. That we're still going to use all the precautions, all of the PPE on the calls, but at least we'll have some comfort knowing that if we do have an exposure, that it's much less likely that we're going to catch it. And I would imagine that we won't be in a position where we have to quarantine anywhere near as many people. The new health agent, Jessica, and Jackie O'Brien, the health nurse, are working really hard behind the scenes to coordinate all of this. So they're really the driving force behind it. There's so much. It sounds really simple. You're just given a shot. The actual vaccination process probably takes 15 seconds, but it's all of the background stuff that has to happen. The screening, they have to make sure that people don't have pre-existing conditions, and they have to be prepared in case there's allergic reactions and all of the things that can happen. You also have to make sure that we're prioritizing the people who are going to get the vaccine, so that there's only a certain number of vaccines available initially. So we want to make sure that they're going to the people who have the highest need for them. So they're the ones that have really worked behind the scenes for that. Some of my staff has helped coordinate the actual scheduling, but really it's been the health department. I'm scheduled up. I'll actually be the first one for the department. I figured that I would. I'll set the tone and show everybody that I believe it's a good idea. It's funny because I'm certainly by no means I'm not a major advocate of tons of routine vaccines. I don't get the flu vaccine myself. That's a personal choice. But when it comes to this, I just personally feel that the risks are too much, whether it's a health risk or me getting a family member ill or my parents, who are 80, getting them ill if I go to visit them. So to me, anything that we can do as first responders to reduce our own risk and help us not catch it and spread it to somebody, I think it's well worth the risk. So I wanted to ensure that everybody in the department can see that I'm doing it, and if I believe it's safe, I hope that they all do too. Hang in there. Hopefully next couple of months we'll see the end of this. Keep doing what we're doing, stay safe, and look forward to the summer.